Hello, my name is Dr. Farman Ali. I am a GP, also known as family physician. Today we will be talking about one of the most common problems that is presented to general practice. It's called urinary tract infections. So what is urinary tract infection? As the name indicates, it comprises of some characteristics, symptoms while passing urine, as well as the presence of bacteria and infection markers in the urine. Broadly speaking, urinary infections are divided into lower urinary tract infections, which includes the bladder and the urethra, and the upper urinary tract infections, which includes the kidneys and the ureters. Also, this may include pyelonephritis, which is an infection of the kidneys. What are the risk factors associated with urinary tract infections? Around 1 in 3 women before the age of 24 will have some form of urinary tract infection, and half of the women will have at least one episode of urinary tract infection during their lifetime. It usually occurs less frequently in men, although at the extreme of ages, in older men, it is relatively common. Other risk factors include recent instrumentation. This also includes catheterization. Abnormality of the renal tract, whether it is by birth or later. Incomplete bladder emptying. This is more pronounced in men with prostate problems. If the prostate is enlarged, they are unable to completely empty their bladder, hence causes the stasis of urine, and they puts them at risk of urinary tract infections. Antibiotics. Women who use antibiotics can change the common bacteria that are present in the vaginal area, and this may make them prone to more urinary tract infections. Sexual activity. A new sexual partner is also known as a risk factor for urinary tract infections. Use of spermicides for contraception is known to be a risk factor. Diabetes. As I said earlier, the presence of a catheter. People in care homes or institutions are more likely to be at risk of urinary tract infections. Pregnancy itself or immunocompromised patients are at risk of urinary tract infections. Patients who have family members with urinary tract infection may have an increased risk of urinary tract infections. So we come to the next bit, which is the signs and symptoms of urinary tract infections. First and foremost is high frequency of urine, which means going to the pass urine more often than usual. Painful, or also known as dysuria. Blood in the urine, also known as hematuria. Foul or offensive smelling urine, it may be cloudy. Urgency. Mostly patients will say, when I have to go, I have to go. Urinary incontinence, especially in the elderly. Pain in the abdomen or in the suprapubic area, just above the pubic bone, is common. It can sometimes have loin pain in the kidney area as well. Rigors or high fever. Nausea or vomiting, more common in children, but can occur at any age. And last but not the least, acute confusional state, and this is more commonly seen in elderly patients. So what investigations would you need for urinary tract infection? It is very important to take a detailed history. Ask the patient about previous urinary tract infections and what antibiotics have they used either for urinary tract infections or otherwise. Has there been any abnormality of the urinary tract? Whether the patients are on any immunosuppressive medications such as steroids, and also to check their sexual history, a new sexual partner. The examination of the bladder and the kidneys is important. However, in general practice, it is the most common indication for empirical antibiotic treatment, both in primary and secondary care. Dipstick of the urine. These sticks are available from the pharmacy or anywhere, and once the urine is dipped into it, the presence of nitrate or leukocytes may indicate urinary tract infection. Trace of blood may be present. Occasionally ketones due to dehydration are seen. Very important not to dipstick urine from catheters. From catheters, the urine is taken from a place called the port and sent off to the laboratory for analysis. Urine microscopy, which is basically looking with a microscope at the slide of urine. The presence of leukocytes or white blood cells indicates infection. The most reliable investigation is urine culture, in which the bacteria are grown on a medium in a laboratory setting. This is important if the patient is high risk, for example pregnant, immunocompromised, or patients with renal tract abnormality, or if earlier treatments have failed to treat the infection. Urine culture should always be performed in men with a history of UTI which are recurrent. Urine culture is not usually required in women who are not pregnant. Another investigation is imaging, ultrasound. This is used to detect any urinary tract abnormalities. It may be required in certain other scenarios when you are thinking of a kidney stone. So when do you refer for ultrasound? Referral for ultrasound or cystoscopy, which is a direct visualization of the bladder, is indicated in patients who have persistently not responded to treatments, have a history of renal tract disease or any abnormality in there. Remember, persistent blood in the urine can be a cause of bladder cancer. So this requires further imaging, which is cystoscopy in these cases, and this is the insertion of a camera directly into the bladder. Women who are not responding and having recurrent infections, or men with 2 or more episodes in the previous 3 months, requires further imaging. So what is the treatment for urinary tract infection? Trimethoprim or nitrofurantoin, they remain the first choice for empirical treatment of urinary tract infections, which means that your clinician might prescribe these on the basis of symptoms alone. This covers 80 to 90% of the bacteria. However, 10 to 20% of the E. coli infections may be resistant to these antibiotics. Current recommendations suggest that the treatment is given for 3 days of either antibiotics in women and for a full 7 days in men. Pyelonephritis, which is an infection which goes beyond the bladder all the way up to the kidneys, is called pyelonephritis. The treatment recommendations for pyelonephritis is oral ciprofloxacin. However, co-amoxiclav or cefalexin are commonly used according to the local guidelines. There are good reasons for not to use ciprofloxacin. Studies have suggested that estrogen may reduce the recurrence of urinary tract infection in postmenopausal women. This estrogen is used for vaginal dryness in these women. However, this should not be given for prevention. Prophylactic low-dose antibiotics, which are given in two scenarios. Number one, in women with recurrent cystitis related to sexual activity, may require 100 milligrams within 2 hours of having a sexual intercourse. This is usually an off-label use. In women with recurrent urinary tract infections, which is not associated with sexual intercourse, a 6 months course of either trimethoprim 100 milligrams at night time or nitrofurantoin 50 to 100 milligrams at night time is given. Nowadays, there is resistance being reported, and hence it might be alternated with an additional antibiotic such as coamoxiclav or cefalexin, depending on the sensitivities. So, what are the complications of urinary tract infections? Common lower urinary tract infection is of no consequence. However, it can go further up, known as pyelonephritis, which is an infection of the kidneys and the tubes that come out of the kidneys. Perinephric or intrarenal abscesses, which means an abscess of pus formation in and around the kidneys. Hydronephrosis, which is a blockage of the urine. Sometimes pyelonephrosis, which is a pus collection in the kidneys and it cannot escape. Sudden decline in kidney functions, also known as AKI or acute kidney injury. Remember, this is not a physical injury. This refers to the function of the kidneys. Last but not the least, and very important, is sepsis. In the elderly, it's one of the most common cause of sepsis who present to the secondary care. Another important one is prostate infections. Men with UTI, between 52 to 90% of men will have some form of prostatitis, which is an infection of the prostate gland when they have urinary tract infections. Thank you very much.